In July of 2008, life changed dramatically for 45-year-old Cindy Losness, and it started with what she thought was just a bad hair day.
So the first thing to manifest was the psoriasis, and I probably wouldn't have paid much attention to it, but it was all in my hair. All in my hair.
Soon, a bad case of dandruff was the least of Cindy's worries. She began having problems with the joints in her fingers.
A bad day starts out where you literally say, how am I going to get myself out of the bed and dressed?
The pain and stiffness impaired Cindy from doing even the simplest of activities, even eating.
My husband had made spaghetti that night, and I could not use a fork to twist the spaghetti to eat. And he had to cut it up for me like a 5-year-old kid and allow me to eat it with a spoon. And I was like, okay, that's enough.
Psoriasis is a type of skin condition that can affect up to 2.3 million people in the United States. 1/3 of them will develop psoriatic arthritis. Ochsner rheumatologist Dr. Con Ho says because arthritis is thought to be an old person's condition, many patients are misdiagnosed.
Psoriatic arthritis is a kind of inflammatory arthritis that tends to affect younger patients. So our average patient will come in anywhere from in their 30s to 50s. So psoriatic arthritis can actually involve your hands, your wrists, your elbows, shoulders, knees, hips, whereas rheumatoid arthritis tends to spare the lower back. Psoriatic arthritis can actually involve the back as well.
Besides the pain is just the fatigue, and I don't know if you've ever broken a leg or had the flu and the aches and pains and chills, but you just don't feel like you can lift your head up.
The more aggressive you treat this type of arthritis, the better the prognosis is for the patient. Dr. Ho says with early diagnosis and treatment, the patient will experience less joint damage, less disability, and will live a more normal life.
I've had some patients that we've been able to, on medications, put them into almost a remission, to whereas they stay on the medications chronically, they don't have any symptoms.
Fortunately, Cindy Losness was diagnosed early, and Dr. Ho says here are some of the warning signs patients should look for.
If you're young, in your 30s and 40s, and you have joint pain that does not go away, that's not precipitated by trauma or an injury, that should be something that you bring up to your physician.
My strongest advice is just not to assume that aches and pains are a sign of aging.
To learn more about psoriatic arthritis, call Ochsner's Rheumatology Department